Live from Eyewitness News, this is breaking news.
Governor Raimondo is giving us her daily briefing on the coronavirus right now. Let's go right to the State House where she's just begun.
For the 1 o'clock daily coronavirus update. I hope you're all having a good Sunday, and I thank you for tuning in. Best thing you can do is keep yourself informed with the facts, and this is the best place to get up-to-date facts on coronavirus in the state of Rhode Island. You'll notice today that I'm joined by Dr. McDonald from the Department of Health. I want you to know and be assured Director Alexander Scott feels great. She's healthy. We just like to give her a little bit of a break on Sundays and whenever we can, because obviously she's working around the clock. But to all of those who are wondering, she's fine, and we're just trying to give her a little rest. Dr. McDonald is fantastic, and he will offer a few comments in a minute. Today I'm very sad to begin this update with the report of another 8 deaths on account of coronavirus, for a total of 25 deaths. Today we have 116 new cases in Rhode Island, bringing us to an official total of 922 confirmed coronavirus cases in Rhode Island, and we're now up to 103 people in the hospital. 922 is certainly not all of the people that have coronavirus. As we ramp up our testing, I fully expect this week, next week, for that number to really shoot up. So don't be alarmed when that happens. We are in a rapid spread phase of the virus, and we have widespread community spread at this point. And this week, next week, we hope to ramp up the testing and catch up so that we have an even more accurate account of the number of folks with coronavirus. I will say this, we are in rapid spread, we're climbing up the curve, we're probably, several weeks away from our peak, but we are climbing up the curve. So that means right now, today, this week, next week, we all have to really pay attention to the social distancing requirements. These aren't suggestions, this is the law, we are enforcing it. And just as hard as it is, hunker down so that we can all get through this as safely as possible, and so that I can get people back to work as quickly, as safely as possible. So it's Sunday. Last Sunday I gave you some assignments, so I'm going to begin today by giving us all some assignments today. Last couple days ago, I asked you all to start keeping a daily log of where you've been and who you have been in contact with. So this is my daily log. I'm doing it, and I'm asking you to do it. Every day, I want you to write down who you've spent time with in person and where you've been. You have to do it every single day. You'd be surprised at how quickly you forget. So the quicker you can record it, the more accurate it will be. Hopefully, for almost all of you, it's going to be a very short list. You're going to say, I stayed at home, I was with my family, I took a walk around the block. Maybe you went to the grocery store once a week. For those of you like us who have to keep going to work, it'll be a little bit longer of a list, which means we have to be that much more careful and write this down. This isn't a joke. This is a big deal. This is serious. Why is it serious? Because this week, we are really going to start ramping up our testing, which means many of you will find out that you're positive. When you find out that you're positive, we will immediately start a contact tracing system. So right away, after you're tested and you find out you're positive, very soon thereafter, the Department of Health will get in touch, and they'll go through an extensive contact tracing discussion with you. At that point, you should pull out your notebook and hand it over to the Department of Health so that they'll have accurate, up-to-date information, or as accurate as possible. So we're doing this for you. This is for you and your family to keep you safe. And the whole name of the game going forward, and what we need to have in place to reopen the economy, is more testing, better, faster, more accurate contact tracing. And it's going to get much more accurate, more technology enabled. But for right now, do yourself a favor, do everyone a favor. Today, everybody, you, your children, everybody in your family, go get a notebook or binder or whatever you like, get creative, and write down in your contact notebook every single day where you've been and who you've been with. Also, if after a few days you realize you're spending time with a lot of different people, you're doing something wrong. I've asked you to limit your contact to the same 5 people every day. So if on Monday you're with 5 people, on Tuesday you're with 5 different people, Wednesday 5 different people, you're not getting the message. So you can't do that. 5 same people every day. I also asked last week on Sunday to do something kind for somebody. And it was pretty amazing how many of you reported back to me in one way or another the kind thing that you did. Everybody was kind of proud of themselves, and I was so proud of you. So do it again today. And don't just do it on Sunday. You know, this is a real struggle for so many people. So many people are sick. So many people have lost their jobs. Elderly folks are really struggling. They're scared. People are anxious. I can't tell you exactly how long this is going to last. I wish I could. I do know it's going to be longer than anyone wants to, because this is terrible for everybody. So the one thing we can all do, which really makes a difference, is to be as kind as possible to the people in your life. So the second homework assignment for today is just take a minute and write down some nice things you can do for other people this week. Maybe you can have your children send a quick little thank you message to their teachers. Teachers are working so hard right now trying to be good at distance learning, and by the way, they're doing a great job. Maybe you can check in on an elderly loved one, check in on a neighbor, write somebody a note. It might sound trivial, but it's the only thing that's going to get us through as a community together. And I would ask you, on behalf of Rhode Island, to just take some time today and be planful about how you're going to show somebody a little kindness in the week ahead. Okay, now we have to have some tough talk for those of you who are still crowding into big box retail shops. I don't know what you're thinking at this point. This is based on fact. I'm not just asking you to avoid big crowds because I want to. If you look at the experience of Germany, where they have been very vigilant on the crackdown for social distancing, or other countries, or frankly, even other states, which are doing a better job than we are complying with the social distancing rules, you see it in the data. Fewer people are getting sick, fewer people are dying, fewer people are in the hospital. Yesterday, I had way too many reports on social media, phone calls from the state police, from local mayors, of big crowds. Crowds at Walmart, crowds at Lowe's, crowds at grocery stores. It's not funny. By doing that, you are endangering your life and the lives of Rhode Islanders. Yesterday, I was asked a question. Somebody said, Governor, are you going to do what Vermont did and say that retail stores can only sell food? I don't want to do that. Hasbro is one of our biggest employers. They sell toys. The last thing I want to do is hurt our local economy even more. But if we don't start complying and getting a whole lot more serious right now, then I'm going to have to shut everything down. And I'm pretty sure nobody wants that to happen. So today, this afternoon, I'm going around in my truck all over the state. And I really hope I don't have to break up any crowds. Because trust me, you're not going to want to be in that group if that happens. Go to the grocery store once a week. Buy what you need, not everything that you want. Why? Because I want you in and out quickly. You shouldn't be at the grocery store for an hour. Don't take your whole family to the grocery store. Go alone. Maybe go with one person. Don't take your elderly loved ones to CVS. Go for them. I can tell you right now, this is about to get very bad. I can tell you right now, there will be thousands of people in the hospital, many, many more deaths, and many, many more people having coronavirus. I can tell you right now, there's going to be a lot more pain and suffering on account of this economic slump. I hate saying that, but I'm being honest. I can't tell you exactly how bad it's going to be, because that depends on you and me doing what the right things are. By the way, I want to thank the big box retailers, because many of them are doing exactly what they're supposed to be doing, checking people in, not letting too many people in. I would ask you to consider even tighter measures, maybe allowing just one-way flow in an aisle. But it's on us. It's on each and every one of us. And by the way, if you're out and you see a lot of people in a store, you see a lot of people online, you see a lot of people at the deli counter, post a picture on social media, because we're tracking that. Go to the DBR website, Department of Business Regulation, and we've set up a way for you to officially kind of file a claim there. So go to the DBR website and tell us what's going on. You can also call them at 889-5550. So I know this is really, really hard. I'm not saying it's easy, but the consequences of not doing it are horrible. And so I'm asking you again to get really serious about this and hang in there with us so we can protect everyone in Rhode Island as much as possible. I want to talk about testing, because we have a new message now. For some time, I was asking you to stay home even if you felt sick, because we didn't have the ability to test enough people. Due to a lot of people's hard work, that has changed. Yesterday, we tested over 1,000 people, well over 1,000. We want to continue to do that every day. And every day, our capacity will increase. I hope to go from 1,000 to 1,500 to 2,000. So my message to you is, if you're sick, call your doctor and go ahead and get tested. We have multiple sites all over the state. National Guard is doing a fantastic job operating these sites. Our labs are up and running. It will still probably take you a few days to get your results, but we want to start collecting more accurate data, which means we have to ramp up our testing. So I'm asking everybody, if you feel sick, call your doctor. If your kids are sick, call the pediatrician, and go ahead and get that referral so you can go get tested. For those of you who might not have insurance, or if you are, for whatever reason, you don't have insurance, you don't have Medicaid, maybe you've lost your job, you haven't yet gotten on Medicaid, I still want you to show up and get tested. We want everybody to get tested. That means everybody. Regardless of your immigration status, I want you to get tested. I want you to not feel afraid to go get tested at one of these National Guard sites. You know, regardless if you have a regular primary care provider, regardless of whether you have insurance. If you've lost your job, you probably qualify for Medicaid, so go ahead and sign up. Having said that, there are a number of places that if you have no insurance or if you're an undocumented immigrant, you can go and get free health care. All community health centers throughout the state of Rhode Island are an option for you. There's a full list of these community health care centers online on the Department of Health's website. So if you're sitting at home, you're scared, you don't have a doctor, you don't have any money, you don't have insurance, maybe you're an undocumented immigrant, don't be afraid. Go to a community health center, go to the Rhode Island Free Clinic in Providence, go to Clinica Esperanza in Providence, or just call the Department of Health. We want to make sure you get care. Now isn't the time for people to be isolated or afraid. I also I want to make a special note. If you go to the testing centers that are being operated by the National Guard, you may see people in an Army uniform, people looking official. Please don't be afraid. These are not immigration officials. You will be safe. We want you to get the health care you need. We want you to be tested. So please, everybody, get yourself tested, find your way to a doctor, consider one of the community health clinics, call the Department of Health. If you know somebody who's afraid and you're hearing me, reach out to them, give them a hand. It's in everyone's interest for everyone to be tested and everyone to have their contact tracing done and everyone to get health care. Final note before I turn it over to Dr. McDonald. We're working very hard on transportation. I recognize that not everybody has a car to be tested. I'm telling you to go get tested, and you might be saying, yes, Gov, but I don't have a car. So we're going to work on that every single day to try to get better and better. But today, I have one announcement. If you have been ordered to get a test by your doctor, and you're a Medicaid member, you're on Medicaid, you can call MTM and they'll schedule you a ride. You can go to the MTM website or you can call 855-330-9131. And if members of the media could get that information out, I'd appreciate it. I do want to be very, very clear and honest about this. Please only use that as a last resort. If there's any way that you can get yourself a ride from a family member, from somebody you know, any way, please do that. This is kind of a temporary solution, and it's there for people because we need you to be able to go get tested. But it's not going to work if they suddenly have a rush of phone calls. We won't be able to handle the capacity. So I want to be honest about that. And again, I hope in a few days, in a week, we'll have more capacity. But for now, if you're sick, if you're on Medicaid, and if your doctor tells you to go get a test and you need a ride, you can go to the MTM website or call 855-330-9131. So thank you for listening, and thank you for your cooperation and your resilience and for being overall fantastic as we get through this together. And I want to turn it over to Dr. McDonald.
So thank you, Governor, and good afternoon. So as the Governor said, we have 116 new cases, and regrettably, 8 of us have passed away. The people who passed away range in age from their 60s to their 90s. 3 of these people were males and 5 of the individuals were females. Of the 8 people who passed away, 3 of those, 7 were nursing home residents, and 1 of them was not a nursing home resident. 3 lived at Golden Crest Nursing Home in North Providence, and 2 of the 7 nursing home residents were in Oak Hill in Pawtucket. Dr. Alexander Scott has been talking the last several days about why this has been such a challenge. You know, when people are in congregate settings, this is hard. And part of the reason it's hard is because how the SARS-CoV-2 virus, the coronavirus we're all worried about, how the virus behaves. You know, the incubation period is 14 days. And what I mean by incubation period is how long it could be sitting in us before we actually show symptoms. But keep in mind, we're contagious about 2 days before we show symptoms, and then it could be a period of time for 7 to 10 days or even a little bit longer. So you're talking about an average time where people could be spreading virus of anywhere between 10 and 20 days. And this is partly why this has been a pandemic across the entire globe and why it's such a challenge. And it's harder in congregate settings here. When you look at nursing homes in particular, you have a lot of variables. You just can't move people from one nursing home to another. There's a couple of reasons for that. We can't move people, regardless of their COVID status, very easily, because you don't want to take the virus from one nursing home and plant in another nursing home. The other thing to keep in mind is when folks are in a nursing home, they're medically fragile to begin with, and transport cohorting someone has its own risks in and of itself. So we have to be careful about that. So we are looking at different options. One of the things that we're looking at is cohorting nursing homes. In other words, identifying nursing homes that would be willing to function as specialty nursing homes. So that's something we're looking at. Other states have done that, and so that's something we're looking at as well. One of the things that we have to just get out there, though, is treatment. We don't really have a good treatment yet. This is, again, why the pandemic is moving at the pace it has and why it's such a challenge in nursing homes in particular. You know, we're still looking for a treatment. The science is moving very rapidly. You know, I haven't actually seen science move as rapidly as it has with this disease. So normally it would take a long time to get a great understanding of what would actually be an effective treatment. But we have to just wait and see. It's moving very quickly, so we'll see if there is a treatment that comes out in a time that's relevant for us. We have talked a lot about the partnership we've had with the Rhode Island Healthcare Association. We've also received some great support from Leading Age, from the Rhode Island Assisted Living Association, and the Alliance for Better Long-Term Care. With that, I'm going to turn it back to the governor so we can address questions. Thank you.
Thanks, Jim.
Thank you, Dr. McDonald. We begin today with a question by Steve Alquist of Uprise RI. Should grocery store clerks, postal workers, and delivery people and others who work with the public begin wearing the cloth masks?
Yes, we all should. We all should. As Dr. Alexander Scott said yesterday, it's not a silver bullet. It does not take the place of washing your hands, staying home when you're sick, keeping appropriate 6 feet distance. But yes, it's one other thing that all of us should be doing when we're out.
Very similar question from Ryan Belmore of What's Up Newport, just again asking if essential business employers should be wearing the masks.
Yes.
The next question is from Steph Machado of WPRI. Now that testing is expanded, are there any plans to retest recovered positive cases, such as healthcare workers, to confirm they are negative so they can return to work?
Yeah, so thank you. So it's the right question, right? So what we want to make sure we establish, if someone goes back out of isolation into work or wherever they're going to go, are they safe to do so? So there's some key concepts. If you've been identified as having the coronavirus disease, COVID-19, you have to be home at least 7 days. And of that 7 days, before you go back out into the rest of the world, you have to be afebrile with, it means no fever, for at least 72 hours, and that's without Tylenol or whatever medicine you use to control your fever. And then your other symptoms need to be improving. Now, for folks who have been tested, if you have been tested like you're a healthcare worker, then we're going to test you again before you go back to work to make sure you're not having the disease as well. So there's kind of a two-test strategy of doing this. If you've been tested on the first time as a healthcare worker, we want to test you again. If you are a member of the general public, we don't necessarily need to test folks like that again. We just know that if you've gone at least 7 days and have been without a fever for 3 days and you're otherwise improving, then you're okay to go back. Healthcare workers are different because as we interact with our patients, remember the first rule of medicine, first do no harm. The Latin is primum non nocere. So we want to make sure for the healthcare worker to go back that we haven't risked introducing anything to our patients, which is another reason why we wear the personal protective equipment. You know, the personal protective equipment works both ways. One, it protects us from getting sick from our patients, but it also protects us from transmitting anything to our patients as well. So thank you.
Governor, the next question is from Ashley Cullinane of NBC 10. Are you negotiating to purchase ventilators or PPE from China for Rhode Island?
Yes, every day we do that. We have a whole team of people who spend all their days negotiating with suppliers, not just in China, all over the world, trying to source ventilators and PPE for Rhode Island. And I will say it's a challenge. I personally have been deeply involved in this, trying to advocate for Rhode Island whenever and wherever I can. We are in competition with much larger states and even with the federal government. So we're holding our own, and I want to give great thanks to Steve King, who is managing this work stream for us. But it's a challenge. It is a challenge, but we are, yes, the short answer is yes. China, India, all over the U.S., everywhere we can get them.
Ted Nisi of WPRI Channel 12 says, Governor, some Catholics are frustrated that you banned the distribution of palms today, especially since you're still letting other items like liquor be sold. Why is beer okay, but palms aren't?
Yeah. So this was a very difficult decision and one that I hated to make. I made it in consultation with public health experts, in consultation with the bishop and his team and the diocese and other dioceses. Massachusetts and Boston is doing the same thing. At the end of the question I asked the experts was, is there any safe way to distribute palms? We thought about maybe just having a drop-off, maybe just leaving them outside, and the experts said no, there was no safe way. We know that this virus lives for a very long time on surfaces. It's sticky to surfaces and lives for a very long time. We also know that many older people would be the ones who would like to have the palms, and they're exactly the ones who have the highest mortality rate. So I'm sorry. I wish I had a better answer. I wish the team could have figured out a way to do it. But right now, the name of the game is safety. And I hope later in the year there might be an opportunity to make up for it.
There seems to be a theme today. The next question is from John DePietro. Governor, Hoboken, New Jersey is now requiring all employees of essential businesses to wear face covers. I'm hearing from many listeners that cashiers at liquor stores and grocery stores in our state are not wearing face coverings and gloves. Is that something you're looking into?
It is something we're looking into. So they should be. They should be. Now, we just made the announcement yesterday, so we'll give folks a chance to comply. But it's like everything else. If we see they're not complying, we're going to crack down on it. What we're also trying to do is massively increase our purchases of the surgical masks. They're in short supply, but we are really ramping up the state's purchases and hope, even this week, to start to be able to distribute some of the surgical masks to more critical infrastructure workers. That is not going to, we're not going to have enough to extend to folks in retail. So for now, I would say I would follow the direction of the Department of Health. Use a scarf, use a bandana, get creative. You should be wearing a cloth mask, all of us, when you're out in the public. At the same time, we are ramping up our purchases of the simple surgical type masks, and we're going to start distributing those.
Tony Mendez from Poder 102 FM asks, have you considered tapping into the immigrant foreign licensed health professionals who live in Rhode Island but lack the U.S. credentials to fill the gap of professionals needed to staff the 2,000 additional medical beds being put into the field hospitals?
We are. It's a great question, Tony, and the answer is yes. We are going through right now to figure out every possible source of talent that we can tap into. I would ask those folks to go on the RI Responds website and sign up if you can help. And we soon, in a day or two, I'll be making announcements around regulatory relief that I will be making on a temporary basis so that we can extend our healthcare system and get ready for the surge.
Kate Nagel of Go Local says, you keep talking about ramping up testing. Per capita, Rhode Island has the worst testing program in New England, tied with Maine, which is a big rural state. Why has Rhode Island failed to ramp up testing until now?
That is inaccurate. At over 1,000 a day per capita, we are right where we need to be. And as I said, by the end of this week, I think we could be at double of that.
Our next question is from Amanda Milkovitz of the Boston Globe. Governor, please explain what the bidding war for PPE and supplies looks like. Is there an increase in costs, and what supplies have we lost to the feds?
We lose supplies to the feds all the time, so it's hard for me to give you a specific answer. Sometimes we lose reagents. Sometimes, right now, ventilators. Right now, it's almost impossible to procure ventilators. The federal government has a lock on those supplies and is shuttling them to places like New York City, which, by the way, need these supplies immediately. It just depends. It's really a very poorly organized system. Sometimes you think the order is coming, the order is canceled. Sometimes you lose to the federal government. Sometimes you lose to another state. So what we are trying to do is just constantly be ordering and is staying on top of our vendors and suppliers.
Michael Bilo of Motif Magazine says Kentucky is reportedly obtaining court orders forcing people to wear ankle bracelet location trackers due to quarantine noncompliance. Would this be legal in Rhode Island, and if so, would you consider it?
Yeah, we're looking at it. So the answer is I don't know yet, but we do know that we have to have effective quarantining and isolation, and we do know there will be an enforcement component of that, and so it's one of the options on the table among other options. What we also know is probably the best way you can ensure that people obey their quarantine is if you make it easier for them to stay at home. Food delivery, medicine delivery, and the like. So we're focused on enforcement. I'll have more to say about that this week. But at the same time, we're focused on ramping up our food and medicine delivery so people have no incentive to leave the house.
Steve Klampkin from WPRO Radio asks, are all manufacturers considered essential? We're being asked, why are the makers of luxury goods such as jewelry and luxury yachts considered essential?
Mm-hmm. I have decided not to shut down manufacturers of any kind, not just luxury goods. As I've said so many times, people need to work. I need to keep as many people working as is safely possible. So we are in very, very close contact, daily contact, with the Rhode Island Manufacturers Association. They've been fantastic about changing the way they do business to allow it to be safe. Testing, taking temperatures of employees before they come in, doing a physical check to make sure nobody's sick and at work, completely spacing the factory floor out differently so people are far away from one another. So, by and large, we have said if manufacturers can comply with the regulations that allow them to stay open safely, then they can stay open. In certain instances, when we've done spot checks and we found they haven't been complying, then we have asked them to close until they make the changes necessary to comply. And that's true. I haven't closed law firms, accounting firms, lots of businesses. We're trying to keep as many people employed as safely as possible.
Bill Bartholomew asks, what are the criteria you are evaluating to move to more extreme shutdown measures?
Number of hospitalizations, rate of growth of hospitalizations, data to indicate whether Rhode Islanders are in fact complying with the orders. We have an ability to check how much movement people have, how frequently people move, how far they travel, spot checks at the retail chains, at businesses that are still open. So there's no one thing, but we want to, it's both a combination of compliance, are people doing what we're asking them to do, or do we have to crack down, as well as just the rate of growth of hospitalizations and deaths, and eventually the number of tests that come back positive. But right now, that's not a great indicator because, as I've said, we're not testing enough people.
Tara Granahan of WPRO is asking Dr. McDonald to step up and answer this. Can you explain the differences between seasonal flu and coronavirus, and why looking at the number of those affected per year isn't a good comparison?
Yeah, so the flu, by the way, the flu right now has really subsided quite a bit in Rhode Island, so we do track that throughout the year. We know right now the flu is really quieting down. And I just say that first because if you feel like you have the flu, you probably don't have the flu right now. You probably have COVID-19. They are different symptoms, though. So the flu tends to hit you like a freight train. It just grabs you with the fever, body aches, and the cough. And, when you have the flu, you generally know you have the flu. It's pretty abrupt, and it's pretty aggressive. COVID-19's behaving differently. It's a much more quieter entry for many folks. They might start with something really trivial, like a feeling they just have a cold. Other people feel they've got the shortness of breath that goes on quite quickly. Some people, when they have COVID-19, it's really day 7 or day 8 before they start to really appreciate the symptoms from when they were exposed. but the shortness of breath grabs them. The myalgias, that means your body aches, and that's something you kind of notice. So there's similarities. But keep in mind why it's hard to compare numbers from the flu or influenza to COVID-19 is COVID-19 is much more transmissible. In other words, you're more likely to spread it to more people. So it's hard to look at what we know about seasonal flu and say, well, here's what we think is going to happen with COVID-19, because they do behave a little bit differently in that regard. That's, again, part of why, because it's so transmissible, why as a virus it's been really successful at becoming a pandemic. You know, if you keep in mind, a lot of viruses come and go, but they don't become pandemics. The SARS-CoV virus seems almost ideal to cause a pandemic because of the way the virus behaves. That long incubation period of 2 weeks, that long transmissibility period of like 10 to 20 days, and then, quite frankly, all the people we get sick because of it. So that's why it's a bit of a conundrum for us and why it's been such a challenge for the country and the globe.
Dr. McDonald, please field this next
sure.
question from Katie Mulvaney. Of those hospitalized, what percentage have pre-existing conditions, and how are such conditions playing into their recovery, and what ages are being hospitalized?
Yeah, so over 70% of the folks who are being hospitalized right now have at least one pre-existing condition. Over a third have more than 3 pre-existing conditions. And what I mean by pre-existing conditions is they have some other chronic disease. It could be something like asthma, it could be hypertension or diabetes. So they have some other health problem here. And because of that, they're more likely to end up in the hospital and not have as good an outcome.
The next question is from Nancy Thomas of RI News Today. For those who live in northern Rhode Island, other than testing through community sites, how is Landmark Medical Center being used for treatment services?
You know, so Landmark Medical Center, as far as I know, is working like the other hospitals, doing the best they can to help identify their patients, isolate those who are ill, quarantine those who are exposed with us in partnership with us. They've been fine as far as, you know, we can tell they're a good partner. All the hospitals have been good partners for us. We have conference calls at least twice a week with the chief executive officers and chief medical officers of all the hospitals. They've all been very cooperative for us. They've all been good about scaling back on their elective surgeries. They've all been good at identifying how many ventilators they have. They've all been good at working with us and identifying extra capacity. So we're seeing some good cooperation from all the hospitals, and I think that's going to continue.
Mary McDonald of PBN asks, is the Rhode Island Department of Health releasing data on the people tested, found positive, and hospitalized by gender, ethnicity, and race?
Yeah, so if you go to the Department of Health website where it says COVID, big red banner, we do have some data on that website about all the people that we've tested, and a lot of the data that the governor presents is actually on the Department of Health's website, and we do identify it by gender and race to the extent that we can. You know, keep in mind as the numbers get larger, those numbers, you know, can help us influence us. Like right now, there seems to be, you know, when we look at inpatients, folks who are in the hospital, there seems to be more men than women, but we don't know that that really means anything at this point, so it's something we keep track of, yes.
Next question is from Kate Walsh. Just like the mask, the question of gloves is a confusing one for people. What is the guidance for wearing gloves at stores? Is it effective? Is it necessary to clean our groceries when we come home with them?
Yeah, Kate, so as far as gloves go, keep in mind, really what I'd like you folks to do is wash your hands with soap and water for at least 20 seconds. That's not always possible when you're working at a store, though. So I'd really prefer you use hand sanitizer. And the reason why I'm not in love with gloves is because when we do transactions with each other at a store, whether we're exchanging credit cards, debit cards, money, if we aren't changing our gloves every time, then those little viral particles, those little fomites, are stuck to our gloves. But if we touch our hand to our face, then those viral particles are on us. So it's hard to change gloves after every transaction. So I'd really prefer folks just use hand sanitizers. Like when I'm in the hospital or my office seeing patients and I put on gloves, I don't go from patient to patient to patient wearing the same pair of gloves. That just doesn't make any sense at all. And so if I in the healthcare profession know that's not the way to go, I just really think folks in the commercial world, we better just not to use gloves at all and have hand sanitizer available for your working staff. I think that'd be better.
Ian Donis asks, is viral load the main reason for why some otherwise healthy people are severely affected, possibly fatally?
Yeah, so we talk about viral load. What that really means is how many viral particles did you get exposed to when you got sick? And that's what viral load refers to. I don't know that it's that simple, though, and I think we have to keep this in mind. It's some of it's just your personal health when we started, and it kind of reminds me to talk a little bit about our own personal health. You know, like, while we're all sitting at home, I think it's tempting to get a little bit stationary, maybe go for the Pop-Tarts more than the strawberries, and that's not a good choice. You know, in a time when we can't control everything, we can control what we eat. You know, so real foods are nutrient dense. Processed foods are calorie dense. And for those of us who need a little bit of weight, let's lose some weight. Let's eat a little better. Let's exercise a little bit more. Let's do things to improve our own personal health. So this morning, I was on my elliptical machine. I ate a healthy breakfast. I had almond butter with some raspberries and strawberries. Some really good choices, you know. Come to my home. There are no strawberry Pop-Tarts. You know, we need to move beyond that kind of processed food. It doesn't help us. And the point I'm trying to get at with your question is, it isn't just viral load. It's about making sure the host is as healthy as possible. That's something we can do to help us out.
Lynn Arditi asks, how many of the 103 hospitalized COVID-19 patients are currently on respirators?
So hi, Lynn. Always good to hear from you. And I just, throw this out. There's 33 people in the hospital. About 31 of those are currently on ventilators. When I talk about ventilators, what we're talking about, just so everybody has a common frame of reference there, that's a machine that breathes for people. And so it's obviously a very important machine for people, and it's very serious. But we're keeping track of that very closely. And we have plenty of ventilators in the state right now. There's people trying to get more, but just to anticipate where you would go next, Lynn, is right now less than 20% of the ventilators we have in the state are currently being utilized.
Thank you, Dr. McDonald. The last question today, Governor, is from Steve Alquist of Uprise RI. Government stimulus money may not reach people whose wages are being garnished, and courts not being open means a moratorium on garnishments might only be possible via executive order. Is this on your radar, Governor?
I'll look into it, and we're hoping to get the stimulus money out as quickly as possible, and certainly the unemployment insurance checks, but I will look into it.
Thank you very much.
Thank you.
Thank you, Doctor.
You've been listening to Governor Gina Raimondo give us her daily update on coronavirus and combating and containing it here in Rhode Island. Some key takeaways today: there have been 8 new deaths to report since yesterday's briefing, meaning there are 25 deaths now in Rhode Island from coronavirus, 116 new cases, meaning 922 confirmed coronavirus cases in total in Rhode Island, with the governor acknowledging yet again that there are likely many more out there, and they're ramping up testing every day to accommodate everyone. There are currently 103 people in the hospital. About 70% of those people, we're told, do have other health conditions, some with even more than one other underlying health condition. If you test positive, the governor said you will be asked by the Department of Health to list all of the places you've been lately and the people you've had contact with. So she's asking everyone today to start taking note of where you go every day and who you come in contact with to make that process easier if you do test positive, and to just notice what you've been doing every day and tracking your movement. Of the eight new deaths, the people range in age from their 60s to their 90s. 3 men, 5 women, and 7 of the 8 of those deaths were people in nursing homes. 3 more at Golden Crest Nursing Center in North Providence. 2 of those were at Oak Hill. So those are the latest numbers for you from today. We'll have all the details for you on our website at WPRI.com.
Stay with Eyewitness News for the latest on this breaking story.